101. In today's live broadcast, we're going to be talking about kidney disease. We're also going to be having some discussion on preventive measure. We're also going to be having some discussion on signs and symptoms of kidney disease. So remember, in Gateway 101, we do not diagnose or treat. All we do here is creating healthcare awareness. That's all we do in Gateway 101. We create healthcare awareness. So whatever we say here does not constitute diagnosis or treatment. Okay, but we do have a simple home remedy that can help alleviate the symptoms. Okay, so without wasting much of your time, we're going to be talking about kidney disease part 2. We talked about it earlier on today, but for the sake of those who do not participate during our live broadcast during the day, we're not giving them an opportunity to participate because this is a very, very interesting topic. Okay, so without wasting much of your time, we're going to be talking about what is kidney disease and what are its symptoms. So kidney disease is when the kidney become damaged and cannot properly filter waste. No extra fluid and toxic from the blood. Remember that one of the primary functions of the kidney is to filter excess fluid and also to filter blood. So when the kidney is damaged, it become it become unable to properly filter your excess fluid or your blood. And so since kidney can also help control blood pressure, balance minerals, and make hormones for red blood cell production, kidney can affect the whole body. If your kidney is damaged, it can affect your whole body. Okay, so let's take that again. Kidney disease is when the kidney become damaged and cannot properly filter waste, extra fluid, and toxic from the blood. So since kidney also help control blood pressure, balance minerals, and make hormones for red blood cell production, kidney damage can affect the whole body. Please do not forget to subscribe, like and subscribe, like and subscribe. This is Gateway 101. There are two main types of kidney disease. The first one will be acute kidney injury, AKI. Acute kidney injury is a sudden loss of kidney function, maybe for hours or days, but often reversible if treated quickly. Please do not forget to subscribe and like this video. Thank you. Okay, chronic kidney disease, CKD, is a slow, long-term loss of kidney function over a month or years. So the common symptom of kidney disease, early kidney disease often have no obvious symptoms, which is why it is sometimes called a silent condition. Okay? Symptoms usually appear when damage becomes more advanced. Okay, so symptoms usually appear when damages become more advanced. So some of the quick symptoms that you will notice will be urinating more or less often than usual. Foaming, when you urinate, your urine become foaming or bubbling urine may indicate protein loss. you're losing protein. Blood in your urine might also indicate kidney disease. Pain or difficulty urinating might also be a common symptom of kidney disease. Frequent nighttime urination might also be a symptom of kidney disease. Please do not forget to subscribe and share and like this video. Swelling, also known as edema. Kidney, because kidney cannot remove excess fluid, swelling in the feet, ankle, leg might occur. Puffiness around the eyes, swelling hand might be a common symptom of kidney disease. Please do not forget to subscribe. Please subscribe and share. Thank you. Okay, so when you notice swelling in your feet that do not subside, if you notice swelling in your ankle that do not subside, you notice puffiness around your face or swollen face that do not subside. In other words, it is not temporarily, it is persistent. Swelling in your hand, you make sure you seek medical attention immediately. It might be kidney disease. But remember, we are not diagnosing anybody or anything here. We're just telling you the simple symptoms that you have to watch out for, because all we do in this channel is to create awareness. Okay, so you feel fatigue or weakness. Kidney help make hormones that produce red blood cell. So if your kidney is damaged, this can lead to anemia. So you become weak and fatigued. Constant tiredness, low energy, shortness of breath. This can be a common symptom of kidney disease. Loss of appetite and nausea, because waste buildup in the blood can cause poor appetite. Waste buildup in the blood can cause nausea and vomiting. Waste buildup in the blood can cause metallic taste in your mouth. So if you are noticing any of these symptoms that I'm talking about, please seek medical help. Because the earlier it is diagnosed, the easier it is to be treated. Okay, so high blood pressure. High blood pressure. Kidney disease can cause or worsen hypertension. So if you have a kidney disease, do not forget that the kidney filter the excess fluid and also filter the blood. So if the kidney is damaged, it will not be able to do this effectively. So this can lead or worsen hypertension. So kidney disease can cause or worsen hypertension. That's just the truth. So persistent high blood pressure, headache sometimes, maybe as a result of kidney disease. Skin problems is another symptoms of kidney disease, because waste buildup might cause dry skin, itching, and darkening of skin tone in several cases. Okay, so if your kidney is not properly filtering the waste from your body, you will be feeling itching. Your skin will be dry. You'll be feeling itching. Oh, no, you just itch. Even though you took a shower, wash really good with soap and water, you see itching. This is as a result of waste buildup caused by kidney damage. Okay, muscle cramp and mineral imbalance. Kidney balance calcium, potassium, and phosphorus. So muscle cramp, tingling sensation, irregular heartbeat if your potassium is high. So if the kidney is not functioning properly, it will not be able to balance these minerals, such as your calcium, your potassium, and your phosphorus. will not be able to balance them because the kidney is not working properly. Okay, trouble concentrating or confusion. Toxic buildup can affect the brain, so you will have difficulty focusing. Sometimes you feel dizziness, mental fog. This as a result of toxic buildup in your system. Okay, so when to seek medical urgency. So, like I've said, this does not constitute diagnosis or treatment. So you still need to see your medical provider to properly diagnose you and treat you. But all what we are doing here is creating healthcare awareness. Okay, so if you have severe swelling, please seek medical help. If you have little or no urine output, you need to see your doctor. If you have blood in your urine, you need to seek medical attention. You have severe shortness of breath. You can breathe, have chest tightening, you have difficulty breathing. You need to seek medical help. You have chest pain. You need to seek medical help. You have persistent vomiting. You need to seek medical attention. So some of the common causes of kidney disease, CKD, some of the common causes of kidney disease, CKD, will be diabetics. Diabetes is the most common cause of chronic kidney disease, followed by high blood pressure. Kidney infection or stone can also cause chronic kidney disease. Autoimmune disease like lupus can also cause CKD. Okay, chronic kidney disease. Long-term use of certain painkiller, NSAID, can also cause chronic kidney disease. Okay, excuse me. So let's talk about kidney disease early detective. How do we detect kidney disease? Let's look and see how this can be detected. Like I said, this does not constitute diagnosis or treatment. So we give you some simple head care tip. Teach you head care awareness. Okay, catching kidney disease early is all about a few simple but powerful lab tests. Most kidney problems start slightly or silently. So these are the best screening tools doctor rely on, like your serum creatinine blood test. Your blood is drawn and the creatinine level is checked. Okay, like as we said, that these are some simple lab work that the doctor might prescribe for you to check your kidney. Okay, so the creatinine is a waste product from the muscle. So if you are a male and if you are a male, adult male, your creatinine level should be anything between 0.7 to 1.3. Anything higher than that, you have some kidney issue that you need to discuss with your medical provider. Then, as a female, your creatinine level should be 0.5 to 1.1 milligram per dl. Anything higher than that, you have some kidney issue that you want to discuss with your medical provider. Okay, healthy kidney will filter out all this waste. So, if creatinine rises, it means the kidney are not filtering well. Limitation. Creatinine alone can look normal. In other words, your creatinine level might be normal in early stage of kidney disease, especially in older adults or people with low muscle mass. Okay, so there's another test again that can also be used to detect kidney disease. That would be your EGFR, estimated glomerular filtration rate. This is one of the most important early kidney function tests that your medical provider might prescribe. It calculated using creatinine plus age plus sex, and also show how well kidney filter blood. So if your estimated glomerular filtration rate is 19 plus, that's normal. That is normal if no kidney damage. So, but if your filtration rate is 60 to 89, this might indicate mild disease. Watch closely. Less than 60 for 3+ months, it might indicate possible chronic kidney disease. Less than 15, it might indicate kidney failure stage. So, best for detecting early decline before symptoms appear. So, the estimated glomerular filtration rate is best detecting any decline before symptoms appears. Okay, you can also use the urine albumin to creatinine ratio, UACR. This is the best test. This is the best early urine test to detect tiny amount of protein leaking into the urine. Often the first sign of kidney damage. Okay, so UACR result less than 30 milligram per G is normal. And 30 to 300 is early kidney damage. Greater than 300, significant kidney damage. Special importance in diabetics and high blood pressure patients. They can also do what we call urinalysis, dipstick urine test, which is the basic. It's a basic screening urine test. They call it a urinalysis, dipstick urine test. Okay, it checks for protein, blood, glucose effection. Okay, it's fast and cheap, but not sensitive as UACR for early protein leakage. Blood urine nitrogen, BUN, it measures another waste product filtered by the kidney. Okay, so higher BUN may suggest kidney dysfunction, but it can also rise from dehydration, high protein diet, or GI bleeding. So it's supportive, not the best early marker. Kidney imaging, ultrasound, is used when doctors suspect structural problem like kidney stone, blockage, a large kidney crystal, or tumor. Not usually the first early screening test, but very helpful when abnormality shows up. Blood pressure monitoring, not a lab test, but crucial. So your blood pressure should be monitored regularly. High blood pressure is both a cause of kidney disease, a sign of worsened kidney function. Keeping BP control is one of the best prevention strategies. Electrolyte and acid-base panel. Kidney disease can affect potassium, sodium, bicarbonate, and calcium phosphorus. So often check once CKD is suspected. So best early detection, Campbell, most recommended. Okay, so if you're having any of these symptoms, like I've said, you should get tested regularly if you screen yearly, or you have diabetics, you have high blood pressure, you have family history of kidney disease, you are over 60, you have swelling in your leg or feet, you urinate frequently at night, you have a history of kidney stone, you'll be using ibuprofen and this NSAID medication for a long time, you need a frequent screening. So early warning sign often means would be kidney disease can be silent, but watch for foaming urine. Foaming urine. Okay? If your urine is foaming or bubbling when you urinate, that is protein leaking into your urine. So these are early warning signs. You have swelling in your feet or face. Your face become puffy, especially around your eyelids. Those are some of the early warning signs. You get tired easily, or you're having a high blood pressure. It's an early warning sign. Loss of appetite, because if the waste build up in your body, you lose appetite. These are early warning sign. So without wasting much time, let us look at some of the preventive measures that can help alleviate kidney disease. Kidney disease is one of those things that often develop quietly. So prevention really matters. So the good news is that a lot of kidney disease can be prevented or delayed when everyday health habit, especially if you start early. So it can be delayed and it can also be prevented if you start early. Okay, so best way to prevent kidney disease will be high blood pressure is one of the biggest cause of kidney damage over time. So you need to control your high blood pressure. Aim for a healthy BP around 120 to 80 if possible. Reduce salty food. Stay active regularly. Manage blood sugar. Prevent diabetes complication. Diabetes is the number one cause of chronic kidney disease. So manage diabetes properly. Prevent diabetes complication. Keep blood sugar in a healthy range. Limit sugary drink and refined carbs. Get regular checkup if you are pre-diabetics or you are diabetics. Drink enough water. Water helps kidney flush out toxins. Drink steadily through the day. Don't wait until you are very thirsty. Okay? So, but people with heart kidney failure may need limit. So, Dr. Albert Masters. Eat a kidney-friendly diet. Healthy eating protects kidney long term. So focus on fruit and vegetables, whole grain, lean protein like fish, beans, and chicken. So limit too much salt, limit processed food, and limit excessive red meat intake. Okay, limit sugary snacks also. Avoid overuse of painkillers such as ibuprofen. Avoid overuse of painkillers, because frequent use of NSAID like ibuprofen and naproxen can slowly damage the kidney if taken often. Use only when necessary as directed. Don't smoke. Smoking reduces blood flow to the kidney and increases kidney disease risk. So quitting is one of the strongest protective steps. Quitting smoking. is one of the strongest protective steps if you're having kidney issue. Maintain a healthy weight. For all, obesity increases risk of diabetes. Obesity increases high blood pressure. Obesity increasing the risk of kidney strain. Even small weight loss help. Exercise regularly. Movement improves circulation and lower kidney risk. Aim for 30 minutes most day. Even walk can't. Also limit alcohol intake because too much alcohol raises BP and causes dehydration. So if you're already having a kidney issue, you should limit your alcohol issue. I would actually say quit drinking alcohol if you're already having a kidney issue because too much alcohol raises your BP and causes dehydration. So moderation is key. Get regular kidney check, especially if you are at high risk. Remember, we're creating healthcare awareness, and we are saying that if you are at high risk, make sure you get regular kidney check, especially if you are at what? You are at high risk. You should check kidney function if you have diabetes. You should check your kidney function if you have high blood pressure. You should check your kidney function if you have family history of kidney disease. Check your kidney function if you have swelling in your feet or face. Check your kidney function if you have frequent urination, mostly at night, or frequent urination changes. So, best test will be your blood work, blood creatinine level, urine protein test. So, prevent and treat infection early. Untreated urinary tract infection, UTI, can spread and harm your kidney. Okay, so see a doctor if you have burning urination. See a doctor if you have fever. See a doctor if you have back or frank pain. Because early warning sign not to ignore would be kidney disease can be silent, but watch for swelling in ankle or face, foaming urine, blood in urine, fatigue or weakness, loss of appetite, high blood pressure, nausea and vomiting. These are some of the early warning signs that you must not ignore. Okay, so for the sake of you who are just joining us, we're going to brush through this. We're going to brush through this one more time so that you can better understand what we are talking about. So let's talk about kidney disease symptoms so that you know what our emphasis is today. Okay, because everything we are doing here does not constitute diagnosis or treatment. So we're only giving you healthcare awareness. I would say that kidney disease is when the kidney become damaged and cannot properly filter waste, extra fluid, and toxic from the blood, since kidney also help control blood pressure, balance minerals, and make hormones for red blood cell production. Kidney disease can affect the whole body. So I would say that there are two main types of kidney disease. I would say that the acute kidney disease, AKI, is sudden loss of kidney function for hours or days, often reversible if treated quickly. Chronic kidney disease, CKD, slow long-term loss of kidney function over a month or a year. Common symptom of kidney disease will be early kidney disease often have no obvious symptoms, which is why it is sometimes called a silent condition. So symptoms usually appear when damages has become more advanced, such as urinating more or less often than usual, foaming or bubbling urine may indicate protein loss, blood in your urine, pain or difficulty urinating, frequent nighttime urination, swelling, edema, because kidney cannot remove excess fluid. You notice swelling in your feet, your ankle, your leg, puffiness around your eyes, swelling hand. These are early signs and symptoms of kidney disease, fatigue, and weakness. Kidney help make a hormone that produces red blood cells. So damages can lead to anemia. So constant tiredness, low energy, shortness of breath. These are some of the symptoms that would persist if you're having a kidney disease. So loss of appetite and nausea, waste build up in the blood can cause a poor appetite. It can lead to nausea, vomiting. It can also cause metallic taste in your mouth. So high blood pressure, kidney disease can cause or worsen hypertension, persistent high blood pressure, headache at some time. The skin problem, we said that since waste are built up, it might cause dry skin, itching skin, darkness of skin tone in several cases, muscle cramp or mineral imbalance, kidney balance. But the kidney balance the minerals such as calcium, potassium, and phosphorus. So muscle cramp, thickness extension, irregular heartbeat if potassium is high. So trouble concentrating or confusion might also occur because toxic buildup can affect the brain. So difficulty focusing, dizziness, mental fog. So when to seek medical help urgently, we say go to the doctor or emergency care if you notice severe swelling, little or no urine output, blood in your urine, severe shortness of breath, you have chest pain, persistent vomiting, seek medical help ASAP. Common cause of kidney disease, we say diabetes is the most common cause of kidney disease, common cause of a chronic kidney disease. High blood pressure is also a common cause of chronic kidney disease. Kidney infection on stones, autoimmune disease like lupus, long-term use of static killer medication, NSAID. Okay, so these are healthcare awareness that we are creating in Gateway 101. Once again, this does not constitute diagnosis or treatment. We are only creating healthcare awareness. If you notice any of these symptoms, please seek medical attention. For prevention is better than cure. Thank you all for watching. Please kindly subscribe and like and share this video. Until I come your way again, this is Gateway 101. Thank you all for watching and bye for now. Thanks.